Hello everyone, so today we're going to be talking about oral cancer prevention in high-risk groups and what implementations we can enforce as dental hygienists during clinical time with our patients in the workforce and in the real world. So here we have the learning objectives. Oral cancer prevention. We can do that by stopping the use of all tobacco products, because we know that tobacco smoking patients are more prone to oral cancers because of their everyday lifestyle, as well as your oral hygiene care, how you take care of your oral cavity hygienically. If you're flossing every day, if you're doing annual 6-month checkups, and if you're brushing twice a day and making sure to always floss, as well as fluoride topical treatments from home to do preventative therapy, protecting our skin from the UV radiation from the sun, alcohol, HPV vaccination, because with HPV, if a person has HPV and they sexually transmit it to another person, that person can then suffer from oral cancer potentially, which the first leading cause would be in the mouth. Poor oral hygiene, which we spoke about. Age, which is people older than 45. Gender, men are more likely to develop oral and oropharyngeal cancer as opposed to women. This is why EOE, IOE is very important, because as dental hygienists, we have the ability to palpate every lymph node to make sure nothing is out of the ordinary for us. So here are a few images. The first slide is a patient with tobacco cessation. This is someone who smokes heavily every single day. In the clinical aspect, they're definitely a perio stage 4, 3 to 4 at least, because this is a chronic individual with heavy smoking. The photo over here is of a person who consumes alcohol on a day-to-day basis because of psychological dependence for both of these type of patients. So we must inform them in an educated and formal way for them to be educated to make their own decision on how they want to handle their future in this certain aspect. With motivational speaking, which is something that we get into a lot of in this lesson plan, because everything is about body language, everything is about volume, how we vocalize and communicate with patients, whether it be through the tell, show, do method, whether it's just educating them from not a patient care perspective, but more of like a friend, a family member, someone we care about, because we always want the utmost care for our patients. And the only way to do that is to be only honest with them through every treatment plan that we go through with patients that have oral cancer, and how to prevent future patients to not have oral cancer. That's why prevention is needed, so we can avoid it, so it doesn't become a chronic thing that develops over time, over a long period. For many people, it could be more of a temporary, early detectable prevention, so we could help people. And the way we help them is through motivational speaking, and through educating them, and through showing them, so they have an idea of what to expect when they go home to continue that preventative care therapy. So with mouth cancer, it can strike in a number of places, including the lips, tongue, gums, and cheeks. It is extremely important that we all know what to look out for. Ulcers that last more than 2 weeks, you must go see a specialist so they can determine if it is benign or if it is cancerous. If it's benign, great, you can treat it. But if it's malignant, that's already giving signs that the cancer will progress and it will be able to masticate to other areas, which is obviously something we do not want. If there are lumps or swelling in the mouth, if there's red or white patches in the mouth, like leukoplakia, that's something to look out for. And early detection is crucial, like we've said, because if you do not notice any of these signs, it could get worse, and we don't want that. We potentially want to treat it and permanently disregard it, but potentially in the patients who are suffering from this. Of course, as dental hygienists, just to put it out there as a disclaimer, we do not diagnose. We just put our input and what we think is a good step for the patient, with the dentist also backing us up with the information that we provide and what we think through the clinical diagnoses. So treatment for oral cancer high-risk groups: recurrent radiation therapy, chemoradiation. So that's basically what many cancer patients go through. EOE, IOE is great for early detection because we are the first ones to potentially see if something is wrong, if there's a hormone imbalance, if the thyroid is off, if the parotid gland, if there's a lump, a lymph anywhere, we will be able to detect it because we palpate the area. Prescription drugs for people who smoke, who do tobacco cessation. So drugs like vernicillin, bupropion, or nicotine patches, which all could be prescribed by a physician, and surgery to completely remove the malignant tumor. Because if a malignant tumor masticates and it moves to other areas, it's just not something that we want, because that will put the patient at risk for multiple different type of cancers. The most common site and most common oral cancers. So the most common site for oral cancers are the buccal mucosa and or tongue, which we did speak about in the previous slide. The mirror is something that is a helpful tool to use, a helpful instrument to use when you're doing the IOE to see any potential blood clots or lesions. That's when we use the ABCDT lesion worksheet method. We see the size, we say if it's flat, if it's broad, and we basically describe the lesion to basically get a better look at what we're looking at, what we're dealing with. So the most common oral cancer is squamous cell carcinoma. It's the most common. It's a very progressive and aggressive cancer. It could masticate, and this is actually a picture of it right here. So this is in the tongue area. As you can see, it looks like a lesion and not flat, and it's very well defined. It has very well defined borders as well. So strategies to implement advice to patients is utilizing non-judgmental speech, delivering a precise, powerful, and personalized message, because at the end of the day, the way we verbalize and communicate is what will give that patient and that individual the motivation to start taking care of their oral cavity, for better oral care hygiene, for themselves, to prevent the forms of other diseases as well, not just cancers, periodontal diseases, biofilm accumulation, acid reflux, xerostomia. So it's important to ask them, quitting smoking, chewing tobacco is the most important thing you can do for your health. As someone who cares about you and your health, I'd like to help you quit, which is a great way to advise and motivate the patient to think of quitting. That's when we would involve the 5 A's when dealing with the tobacco cessation. But since this is a generalized topic about implementation and prevention for oral cancer high risk groups in general, we're not gonna get into that. But preventative therapy can done right from the comfort of your home, ensuring you floss and brush twice daily, and follow annual dental checkups and cleanings. It will put you on the right track. It'll divert a situation from happening as well. Going back to EOE, IOE, it's one of the fastest ways to find any lesions within the lymph nodes and oral cavity, which is a great thing to do for patients, for all patients, even in the outside world. I know many patients and many dental hygienists don't practice this in the real dental world. I haven't seen it in any dental office I've ever been to, but hopefully that changes, because it's super important. If we can detect cancers just from doing EOEs and IOEs, we should take that and even have physicians do it, because it's just a great tool to have. It's early detection. It gives the ability to potentially treat the diagnosis early on, and it includes palpitations of the head and neck to identify any tenderness, masses, and lymphadenopathy, which is something that has to do with all types of oral cancers, because they're masses, they're tender, and they could end up in the lymph nodes. So this is basically all of the lecture. So I hope you guys enjoyed watching. Thank you.